Let us first begin this topic by reviewing some basics about breast cancer, epidemiology, anatomy, and pathophysiology. As infectious diseases have better treatments and the lifespan across the world increases, so does the global burden of cancer. There are currently 14 million new cases of cancer diagnosed each year, with the majority being in low and middle income countries. There are roughly also 8 million deaths due to cancer, and the majority of these also, unfortunately, take place in low and middle income countries. As far as breast cancer specific statistics go, it is the most common cancer in women worldwide, which is why you see on this map that nearly the entire world is pink, which represents breast cancer. There are 1.7 million cases reported annually, with 25% of those being just breast cancer. 500,000 deaths are also reported annually. And while the incidence of breast cancer is still higher in developed countries, mortality is higher in developing countries. To give you an example, breast cancer in sub-Saharan Africa is among the lowest in the world, with a reported 27 cases per 100,000 women, as compared to 91 cases per 100,000 women reported in North America. However, the mortality is as high as high incidence countries, with nearly 20 deaths per 100,000 women. This is much higher than that of North America for the same year, which is 14.8 deaths per 100,000 women. There are multiple reasons behind these mortality statistics, and they include poor awareness among women of breast cancer signs and symptoms, absence of early detection programs such as mammography, and late-stage presentation. Even after breast cancer is discovered, there may also be issues in terms of both availability of treatment and cost of individual treatments to the patient. It is important to review the normal anatomy of the breast. The breast does not have any muscular structures within it. It is made up of 3 components: fat, glands, and lobules. The glands and lobules are the structures that are primarily at risk for the development of breast cancer. As you're already aware, breast cancer is abnormal, uncontrolled cell growth arising in the structural components of the breast. Cancers found within and invading the ducts make up the majority of breast cancer, whereas lobular cancer makes up a much smaller percentage. A very obvious question would be, what causes this uncontrolled cell growth within the breast? Multiple risk factors have been identified for the development of breast cancer. However, there has not been shown to be any one single cause for the development of breast cancer, with the exception of those who are genetic carriers. However, many risk factors have been identified. The risk factors can be grouped into those that are non-modifiable and those that are modifiable. And these generally include genetic, reproductive, and lifestyle-related factors. In the non-modifiable category, one of the most important risks is family history, as this can heavily relate to the individual risk for that patient. There are also several controversial risk factors that are often talked about, and these can include caffeine, cell phone use, and antiperspirant use. At present, there is no evidence to suggest that any of these cause breast cancer. There is, however, some evidence that links diet, environmental hazard, and smoking. And so these are some things that we should always be asking about when we're taking a history of a patient with breast cancer. Going back to family history, I'd like to spend a few minutes talking about genetic risk. Heritable breast cancer currently represents 10% of all breast cancer. And there are 2 genes, BRCA1 and 2, or BRCA1 and 2, which account for the majority of this 10%. Both are autosomally dominant inherited and have a roughly 50 to 60% lifetime risk of the development of breast cancer. While the ovarian risk is much less with BRCA2, it is still substantial as compared to that of the general population. There are also several currently lesser genes which can confer significant breast cancer risk, and those are shown here. The full risks associated with each of these are still being elucidated, and we still do not know the full extent of the cancer risk with these, as well as other genes which may still remain undiscovered. There are several models that have been developed and studied to help predict risk. And when used correctly, they can aid in determining an optimal screening schedule and when prophylactic intervention should be employed. None is perfect, and thus accuracy remains a big issue. And though this slide has a lot of information on it, I am trying to show major risk prediction models used in breast cancer and hopefully highlight some of the differences among them. There are those that predict the risk of the development of breast cancer in healthy women with a family history, and those that predict the risk of BRCA. One of the best validated is the Gale model. This is used for healthy women without any personal history of breast cancer, but who have a family history. Because it takes into account only first-degree relatives and has a limited number of factors, the Gale model ultimately may underestimate the overall risk for any one patient. The Klaus model is similar, but also requires the age of diagnosis of the relatives. Neither of these estimate risks of being an actual carrier. For these, we must use the BRCA-PRO model or the breast and ovarian analysis of disease incidence and carrier estimation analysis model. Both of these are used to determine the risk of being a carrier of BRCA1 and 2. Again, these models can help to guide prevention and screening strategies for individual patients, but can also help to guide testing for BRCA1 and for BRCA2. So to summarize this first section, breast cancer is a disease which is increasing in both incidence and mortality, particularly in low and middle income countries. Breast cancer at the cellular level anatomically develops in two major structures of the breast, the ducts and the lobules. Both are lethal if not properly diagnosed and treated. Many of these deaths are preventable with appropriate education and awareness programs, which will highlight the risk factors for the development of breast cancer. Once a woman's risk of breast cancer is known, additional protective strategies can be employed.